Hi, so as you open the app and get access to it, it opens up with a beautiful animation, and yes, you can use this app so seamlessly that you can switch in between the female community healthcare volunteers, doctor, and supervisor. You can open up your account using your phone number or email, and it sends a link to your email for verification. After it gets verified, you get access to this app. So you end up in the home page, and it is quite easy to use. So when you register a patient, you can add in the details. We focus mostly on clinical data measurements and not on personal identity information to prioritize safety issues, and we can fill in the information related to the patient regarding name, age, gravida, and para, that is the total number of pregnancies and the viable pregnancies, as well as the last menstrual rate and other necessary details associated with the patient. So you get back to the home page, and it is quite easy to use in a sense that you can access patient from so many different areas. So it's quite comfortable to use for the female community health volunteer, and you can see the patient list, patient moderate and high risks, and so for now we look at the patient at high risk. So this patient is at the risk score of 85 out of 100, so she is at high risk, and you can see the pulsing indicator, breathing pulsing indicator of high risk. And the main feature that we have got is longitudinal risk uh, trajectory that is made based on several visits, particularly 8 visits related to preeclampsia based on WHO antenatal care guidelines 2016, and it is not just based on one visit. So we have 3 different visits here, and it indicates that the patient is at the high risk. It is the cumulative effect of several factors related to preeclampsia. There are total about 8 factors, mostly named as proteinuria, edema, and headache, and other symptoms related to preeclampsia, and it is rated by the female community health volunteer. And you can see the pulsing indicator of high risk here, and the alert of risk escalation detected, and that means the female community health volunteer can now generate a referral. As she sees the risk escalators, she can generate a referral, and the referral is not just to the hospital but also to the other health volunteers and health services and facilities that might be required for the patient to be sent to the hospital for recovery. So it might be other healthcare volunteers as well, and the hospitals, it might be the district health hospital or the main hospital, headquarter hospital, all the other health facilities that might be available around the locality. And for the provisional diagnosis, we have preeclampsia and other related conditions, and as you just saw that we can also have a look of a SMS preview. And when you generate a referral successfully like this, you can also download the PDF related to it. And the most interesting fact here is that after you generate a referral, it's not just a one-way referral system but a closed referral system, in a sense that the patient arrived when it is confirmed by the hospital and send SMS, we get the response back, and it's a closed referral loop system. So the patient and her information will be recorded till the patient is discharged. So it's a closed referral loop system, and it's the most distinctive feature that opens up a pathway for the interoperability with the ministry, command center, and health services and hospitals, and so we can also compare the visits in between visit 1, visit 2, visit 3, You can check on the symptoms. It will be quite useful for the female community health volunteer in a sense that they can look at all the symptoms at once and compare which visit was the most riskiest or what is the overall situation. And of course we can also record the image, take the image, of course with the consent of the patient, and we can take many different kind of images. We can put a tag related to the image of what exactly the image is about. Maybe it's for the symptoms, maybe it's about the personal details of the patient, so we have the options for that. You can choose in between that and then open up your camera to take a photo, and you can also upload the file related to the category that you're trying to send the image. Okay, this low memory is due to my device, not related to app's default. So we can also choose know about the postpartum depression based on Ehrenbach postnatal depression scale. So we have different symptoms and you can rate it in the scale of 5. We get the on the scale of 10, and then this app helps us to know at what level of risk the patient is at. So this patient is at high postpartum depression risk and refers for the counseling. And more than that, we also have a quite distinctive feature of offline LLM that is designed for the female community health volunteer to know about the technical medical terms which they might not be quite comfortable with. Maybe they are not familiar with the terms within this app or the other scientific terms in medicine, so they can ask questions. It is totally offline, and they can ask what is preeclampsia, so they will know about the situation, they will know about the condition. They can also ask other related questions like explain G2, PO, all the technical terms. It will be explained by this local AI chat system. And yes, the very useful feature here is that we also have health ministry dashboard section that opens up our interoperability and to help us function in sync with DSIS and HMIS, health management information system. So it makes the whole process quite seamless, and it also shows the record for the hospital about which patients are at what level of risk and in what numbers. So this is the main way for us to do business in B2G SAS. And we also, as you also saw, that we can switch in between dark and light mode, and we can also switch the language that helps the female community health volunteer to use this app quite comfortably in the language that they want. And we can switch in between offline and online mode, and this app easily detects it. So you can use all the functions in offline mode as well. You can put in data, you can get the chart, and it syncs seamlessly after it connects to the internet. And more than that, we also have predictive prediction feature that प्रक्षेपण देखाउनुहोस् वा लुकाउनुहोस्, where we can see the situation after the patient recovers, going to the hospital with the green line, and the next line, the red one, shows where the patient might end up in terms of risks. And more than that, we also created a different prototype, a different app using Manus. You can also check it out. I pasted the link. So this is totally another app based on same feature but different UI and different user experience. Almost all the features that are available in the lovable version is available in this one as well, but it's a different experience.